Hi everyone, my name is Shivgami Arora. I'm one of the 19 Iowa medical students who's doing the year in Des Moines, and I'm going to tell you a little bit about the inpatient internal medicine rotation in Des Moines. Quickly, how it's organized, it's split up into 2 3-week blocks because of course it's a 6-week rotation. 3 weeks you will spend at the Methodist Hospital, which is right across the street from where you'll be living in the in-towner, and then 3 weeks are spent at the VA, which is like a 10-minute drive from where you'll be staying. The call schedule is the following. You'll spend 5 weeknights on call throughout the entire 6 weeks. What that means is you go into the hospital as you normally would, spend the day there, stay until 10 p.m., and then you're free to go home. Then there's 2 weekends that you'll be on call throughout the entire 6 weeks, and that just basically means you come in Saturday and Sunday morning, round on the patients, and then you're free to go home. So there is no overnight call at all in Des Moines for the inpatient internal med rotation. Throughout the rotation every week you'll kind of be expected to have 2 or 3 patients that you take care of as if they were your own. And then during 1 to 2 afternoons a week you will spend in didactic sessions with a number of different faculty here, in which you'll go over, important topics that come up in internal medicine often, like DVTs, PEs, renal failure, and things like that. So a typical day here on your inpatient rotation, whether you're at Methodist or at the VA, really would be having some sort of morning lecture, like a grand rounds situation or a morning report, and then pre-rounding on your patients on your own. You don't have to go in with the resident. You're free to kind of do what you want in the morning while seeing your patients. And then rounding, of course, with the faculty and the whole team. During lunchtime, then, there are almost every day, one of the subspecialties within internal medicine will be sort of represented. There will be a talk given by one of the faculty here, and lunch will be provided. And you are also actually given a stipend to use at your disposal at the Methodist cafeteria or cafe throughout the entire 6 weeks. And then in the afternoon, you can either admit patients with your attending or with your first-year resident that you will work closely with, or you can work on the assignments that will be the same whether you're here in Iowa City. You have the same assignments. So just to tell you, I guess the strengths of the rotation here in Des Moines and what I liked most. Number one, it's a very close-knit group that you work with in terms of the first-year resident that you work with, the attending, and then the senior resident. Your opinions are always going to be heard. There's no sort of hierarchy that you have to go through in order to get your opinions and your or be heard about what you think needs to be done with the patient. There's respect for your time as well, in the sense that there's no sort of overnight call and there's no unnecessary time that you have to spend at the hospital. Number 2, the education sessions are really phenomenal here. I want to emphasize that this is very much an academic setting. In spite of it not having the university there, it's still a very academic setting because it has a residency program. So you are sort of treated as a resident in the sense that you have access to all the same sort of educational sessions that they do, and you have the same didactic sessions that one would have at Iowa City. You have them here as well, and it's actually a smaller group, so it's more informal, and there's just 3 or 4 students that kind of talk about the topics with the attending. And then lastly, what's really great is you get to meet a bunch of different students here. You get to meet other medical students that are from DMU, which is great, and you get to meet like podiatry students, pharmacy students, get exposed to sort of an entire team of different medical specialists that happen to be your same age group and experiencing some of the same things you are. So thanks for letting me tell you about the inpatient internal medicine rotation.